Hello, good evening, everyone. How's it going? How's it going today? So, as you know, the topic is going to the doctor, right? So, today we're going to talk about, hello, hi, Juan, hi. We're going to talk about the vocabulary related to going to the doctor and diseases and also some grammar connected to that too, right? Sorry, I'm just checking the chat here to see like who's in the chat, right? Um, and we're going to continue. All right. Okay. So everything's all right here. Everything's all set. So I guess we can start. I'm going to share my screen right now so you can see the topic and we can start. So here we have it. Live stream. Basic. So this is going to be for basic and pre-intermediate levels, right? So if you're from the basic level, you can watch it. If you're from a pre-intermediate level, you can watch it too, and you'll be able to understand it. As an overview, we're going to see parts of the body, right? Since we're going to talk about going to the doctor, then this is a very important part of the vocabulary. So parts of the body, the human body. We're also going to talk about diseases and illnesses. So this is about being sick, right? Being sick, diseases and illnesses, right? And we're also going to have some practice after that and a dialogue as usual, right? So we're going to have a dialogue, which is a conversation between a doctor and a patient. So as the first uh, words we need to understand before we start is head. So parts of the body, right? So here we have the main parts of the body. So you have head, and then in the head you have the face, which is this whole part here, right? Just the face here, and on the face, right? We have eyebrows, right? So eyebrows here. This is one eyebrow. This is another one. We have the eyes. So one, another one there. Nose over here. A mouth, and be careful with the pronunciation of this one here, right? It's mouth. Okay, it's mouth. All right. And here we have the chin. This part here is the chin. A very short E sound, so chin. Here we have chest, right? So we have the chest, stomach, leg, and toe, right? Leg here and toe. Here we have the foot, right? And for each foot, we have 5 toes, right? So we have 5 toes on each foot. So both foot together, we actually call them feet, right? So the plural foot is feet. So both feet together, we have 10 toes. And we have the knee right here. Em português, knee é o joelho, tá? Joelho é o knee, ok? Toe são os dedos do pé. Dedo do pé vai ser toe, right? So toe. Se for dedo da mão, vai se chamar finger, okay? So fingers are those in the hand, whereas toes are those in the foot, right? So here we have the hand, we have the elbow, right? So elbow in português é o cotovelo, okay? O cotovelo é o elbow, right? So knee é o joelho, elbow, cotovelo, arm, we have the arm, right? Arm, the back over here, shoulder, right? So we have 2 shoulders, right? One shoulder over here, the other shoulder over here, right? A neck, all right, here, neck, yeah. The ears, right? So you have 2 ears, right? Ears and the hair, right? The hair. So this is my hair here too, hair, all right? So ears and hair, you can see here in the picture too. Here we also have buttocks, right? Here the buttocks, yeah, which, like in vulgar English, you could just call it the ass, right? So people's ass, right? And the heel, right? Which is the back of the foot here. Yeah. Right. So now I want to ask you, which which diseases do you know in English? Quais doenças você conhece em inglês? Right? Which diseases do you know in English? And you're probably thinking about some of them. Any ideas? Anybody there? If you know any, you can type there in the chat. You guys are so shy today. Don't be shy. You can just type there. Não fiquem tímidos. Podem digitar aí. You don't need to be shy. Right. So here we have some of them. A headache, right? Headache. We're going to see later what they are. Tiredness. Quando você se sente muito cansado. Tiredness, right? It looks like a crazy man here, crazy person, right? Body ache. So, ache, em português, ache significa dor. Então, qualquer tipo de dor vai se chamar de ache. Body ache é dor corpórea, dor no corpo. So, body ache here. So, when the body aches, right? So, it hurts, like you feel that it hurts, like in your body, right? Here we have sore throat. Sore throat. So, this is my throat, okay? Throat, em português, a garganta. Pay attention to the pronunciation here. It's throat, throat, okay? And sore, it means that it hurts. Just like ache, so sore, it means it hurts. So if I have a sore throat, it means that my throat hurts. My throat is usually red, and it's very it's not very comfortable, right? So you feel very uncomfortable when you have a sore throat. Here you have cough, right? Cough. And be careful not to say coffee, okay? Many of my students, when they're just starting to learn English, they tend to say coffee, but be careful because coffee, it's café, okay? Café, it's coffee. That's what you drink, okay? You drink coffee. But here, he has a cough, okay? Cough, cough. He also has a runny nose, okay? Runny nose. You can see here, there's a drop coming out of his nose, right? And also fever. You can see a little symbol of a fire symbol here, right? Fever, right? So you feel very hot, right? So it's fever. You can sweat, especially at night when you have fever, you might even sweat, right? So let's take a look at aches and diseases one by one now, one by one, right? What is this one? Take a look at the picture. What disease or what ache is this one here? So this is a headache, right? Headache. So here you have the word head, right? Head here. This is my head, okay? Head. And here we have the word ache. So it means that the person's head aches. It hurts, right? Aches. So a headache. What is this one then? What is this one? Look at the picture. Type there in the chat. If you know it, type there in the chat. What ache or disease is this one? Okay, I'm going to tell you. This is an ache, okay? So this is stomach ache, right? Stomach ache. And stomach has two meanings in English, right? It could be o estômago, né? E pode ser também a barriga, né? Então, barriga ou estômago em inglês, in English, they're both called stomach, right? So here, stomach and the word ache here, stomach ache. Yes, that's right, one. Yes, stomach ache. This woman here, what's the matter with her? What's the matter with her? You see, something hurts here, right? So what do you think the problem is here? She has, what kind of ache is that here? What is this? This is my ear, okay? So she has earache, okay? She has earache, right? So stomach ache, earache. Now, take a look at this man in this picture here. What hurts here? You see, he's touching this part of the face here. So what hurts here? Think about it. What are these? Look at his mouth. What are these here? These are the teeth, okay? These are my teeth. So all of them together, we call them teeth. If you're talking about only one, then it's a tooth, right? Pronunciation, tooth. So here he has toothache, right? He has toothache. Toothache. Who's there? Yeah, like who else is there, guys? I can see there are some people in there, but you are so shy, like nobody, just a couple of people are typing here. Okay, toothache. Pronunciation, remember, TH sound, right? You have to put the tip of your tongue between the teeth. So it's tooth, tooth, toothache. Next one. What's the matter with her? What's the matter with her? Any ideas? She's coughing, right? So here it's a cough. So here it's a cough. And this boy here, what's the matter with the boy? He has fever, right? So that's fever. Fever. Okay, so let's take a look at all of them. Here, if you can just repeat after me. Headache, headache, stomachache, stomachache, earache, earache, toothache, toothache, cough, cough, and fever, fever, right? So moving on. What's the matter with her? This woman here. So she has a cold, right? She has a cold. And this woman, she has the flu, right? Can you tell the difference between one and the other? What's the difference between a cold and the flu? Just think about it. The cold is something more simple, right? And the flu, it's more serious, right? So a cold, you can catch a cold and have a cold for 1 or 2 days, for instance. But the flu, you could have it for longer. You could have the flu for 1 week, for example. Sometimes even more than that, even longer than that. And when you have the flu, you usually have a headache too, you know. You have some body aches, so sore throat. So the flu is definitely more serious than the cold. Ok? Então, o flu, ele é mais sério do que o cold. Okay? The flu is more serious than the cold. Now, take a look at this man here. What's the matter with him? What's the matter with him? So he's sick, right? We don't know what exactly the problem is, but we know that he's sick, right? So he's sick. And this man here, he's more than sick. So we say he's ill. He's ill. He's very sick. So he's ill, right? So here we have a cold, the flu, sick, and ill. Now, look at the picture and take a look at the question here. The question I was asking you before, it's what's the matter with him, right? What's the matter with him? Em português seria qual o problema com ele? So, what's the matter with him? Or you could also ask, how is he feeling? How is he feeling? Como ele está se sentindo? How is he feeling, right? And here he has, what is it? Anybody? Yeah, he has a headache, right? He has a headache, right? Now, take a look at the second picture. What's the matter with her? What's the matter with her? How is she feeling? She has a cough, right? She has a cough. Or she has a cold too. Sometimes I have both together, right? She has a cough and a cold, right? Now, take a look at the boy now. What's the matter with him? What's the matter with the boy? Or you could ask, how is he feeling? He is. That's right. Very good. So he has a fever, right? So you say he has a fever. Okay, he has a fever. Very good. Very good. Now look at this man here. What's the matter with him? Where hurts? Where does it hurt? So it's in the stomach, right? So he has. Very good. Yeah. So what's the matter with him? He has stomach ache, right? He has stomach ache. How about this woman here? What's the matter with her? Remember, it's the ear, right? So she has what? What's the matter with her? How is she feeling? Yes, yes, she has earache, right? She has earache. She has earache. And this man, remember, the problem is in his teeth, right? So what's the matter? He has. Oh, how do you say it? Is it teethache or toothache? Which one? It's toothache, right? Although we have many teeth, although although you have many teeth, right? We usually say he has toothache, right? So he has toothache. Um, And how about this woman here? What's the matter with her? What's the matter with her? How is she feeling? She has the flu. Yes, she has the flu. So her case is more serious. She has the flu. How about this man? Remember, what's the matter with him? We don't really know, right? We don't really know. We don't know it exactly. We just know that he's sick, right? He's sick. Então, quando a gente não sabe exatamente o que que é só falar, ele tá doente. So he's sick. He's sick, right? And how about this man here? What's the matter with him? How is he feeling? So he's more than sick, right? In that case, he has some sort of a serious disease, probably. He's in hospital, right? So we say he's ill. He's ill, right? So, então, quando é uma doença mais séria, se diz he's ill. He's not just sick, he's ill, right? He's ill. Uh, so here we've had almost all of them. I just want to show you here on Microsoft Word some notes I want to show you. Oh, this was about a previous class. Okay, but this is what I want to show you here. We're talking about tooth, right? So tooth is only one. Okay, so when you have one, so you say one tooth, right? If you have two or more, then we say teeth, right? So that's the plural. So one tooth, two or more teeth. All right, so that. Other words related to going to the doctor we could consider are, for example, a prescription. Okay, prescription, prescription. Okay, prescription. That's em português é o que se chama de receita médica ou a prescrição do médico. So it's prescription. If you want, you could say doctors. So doctor's prescription, a receita do médico, doctor's prescription, right? Also, the place where you go to see a doctor, we usually say, for example, somebody like he, for example, the man in the picture, he needs to see a doctor. He needs to see a doctor, right? Em português se diz ele precisa ir ao médico, but in English it's more common to say he needs to see a doctor. So this see a doctor means to go to a doctor's office, which is the next word here. Doctor's office. Doctor's office is just like a clinic, right? A clinic. Clinic é uma clínica, doctor's office é como uma clínica também, a clínica médica. So doctor's office, clinic. Or if it's something more serious, you can go to a hospital. Hospital, right? Hospital. Just on a cultural note, in certain countries, going to the hospital is way more common than in Brazil. In Brazil, people usually only go to a hospital when they have something really serious to treat, when they have to, to perform a surgery or something like that, or because of an accident or because there's an urgency. But in other countries, it is more common to go to the hospital when it's not something as serious because you might be you might go there just to see a doctor, right? So many doctors they work they have their doctor's office, right? They have their office in a hospital, and then you go to the hospital not because you have something very serious, like a very serious disease, just because you're going to see your doctor in the hospital, right? So that's something different from Brazil. Now, let's get back to our slides here and take a look at the next part, which is this one here, the dialogue, right? So this is a dialogue between a doctor and a patient, right? Doctor and patient. É diálogo entre o médico e o paciente. Doctor and patient. Here we have the doctor and he asks, how are you feeling? Right? How are you feeling? Como você está se sentindo? How are you feeling? Right? And the patient, he says, I have a fever. I have a fever, right? Eu tenho febre, I have a fever. What should I do? And now there's maybe, if you don't know it, it could be a new word to you. What should I do? Em português é o que eu devo ou o que eu deveria fazer, né? What should I do? So he's asking for the doctor's advice. And the doctor says, have a day off from work and take these pills. You should also drink a lot of water. You must take a rest. Okay, so these are all the doctor's recommendations, right? Have a day off from work, em português significa tire dia de folga do trabalho. Okay, day off, it means a day that you do not work, right? A day that you do not work, it's called a day off. So have a day off from work and take these pills, né? Então, tire dia de folga e tome esses remédios, esses comprimidos, né? These pills. So pills, it's just the form of medicine, right? Pills. And by the way, medicine, it's something else I can write here in the vocabulary, in our vocabulary list here. So pills, so you can say, take some pills, right? Take some pills, which means tome alguns comprimidos, né? Or medicine, which means remédio, right? Em português, remédio. Medicine is what you take when you're sick, when you're ill. So you take some medicine in order to improve, in order for your health to become better, right? So to improve your health, then you take medicine. And the doctor, right? So doctors, they prescribe, doctors prescribe medicine. Okay, so doctors prescribe medicine. So we talked about the word prescription. Prescription is the noun. Okay, prescription é o substantivo. Now we're going to talk about the verb here, prescribe. Prescribe é o verbo, prescrever, né? É receitar, né? Receitar, prescrever. Com os médicos, eles prescrevem, eles receitam remédio. So doctors prescribe medicine, right? Doctors prescribe medicine. So remember that medicine could have different meanings, right? So have medicine is what you study at university. You might go to university to study medicine because you want to become a doctor. Ou seja, você quer estudar medicina porque você quer virar um médico, então o termo é medicine. Or you could want to take medicine, right? Take medicine. É a mesma palavra, mas com dois significados diferentes. Então, take medicine significa tomar remédio, ok? Take medicine. Se você quiser estudar medicina, você vai falar study medicine. It's the same word, study medicine. É a mesma palavra, mas com sentidos diferentes. You could study medicine or you could take medicine too. Now, let's get back to our dialogue again here, right? And here it says, he asks that, what should I do, right? So what should I do? E o que eu deveria fazer? So have a day off from work, take these pills, and then he continues. You should also drink a lot of water. Remember, also, it's a word we talked about in another class. It means to, right? So you should also. So also, it's the same as to, right? So he says, you should also take this medicine, right? Or you should take this medicine too. All right, so there are two ways you could say that. You could say this way, or you could say it this way, right? You should also, você deveria também tomar este remédio. You should also take this medicine. Or, you should take this medicine too. Você deveria tomar esse remédio também. Yeah, should also take this. You should take this medicine too, right? Remember the difference? When do I use also? When do I use to? Right? I think maybe from here it becomes clear that also is used before a verb or before another word in the sentence, right? So also comes here in the middle of the sentence before a verb or another word. But the word to is used at the end of the sentence. To é sempre usado no final de frases. Pode ver que não tem mais nada escrito aqui depois de to. To, okay? All right, now let's continue. Take a look at the dialogue here. So you should also drink a lot of water. Bastante água, né? Você deve também beber bastante água, a lot of water. You must take a rest. And then he continues, he says, you must take a rest, right? So you must take a rest. Must is more of an obligation than should. All right, so must let me change to italic here. So must here, it's seen as an obligation, okay? É uma obrigação, é algo que você tem que fazer, não pode ficar sem fazer. So must. Essa aqui é a principal diferença entre o must e o should. Should é um deveria, mas assim, com menos obrigação do que must. So you must take a rest. That's the doctor's recommendation. Você tem que descansar. Take a rest here, it means descansar. So you must take a rest, right? Should here. So you should take this medicine too. Né? Você deve, mas é um dever assim, né, que se você não quiser tomar, não pode até nem tomar, né? Mas é altamente recomendável, mas não é uma obrigação. Já aqui não, está falando em must, é uma obrigação. So you must take a rest, all right? Must take a rest. Now let's take a look back at the dialogue and see here. That's all about the dialogue for now. Now we can continue, can move on to our last. This next slide is actually the last one. So we're coming very close to this class already. It's a short class. Okay, so this is the question the patient was asking, right? The doctor, what should I do? What should I do? O que eu deveria fazer? O que eu devo, o que eu deveria fazer? What should I do? Remember the pronunciation here, okay? Should I, all right? So we say these two words together here. Should I, right? And the D sounds like an R here. So it becomes like an R, it's like a Spanish R or Portuguese R, okay? Not the English R. So what should I do? What should I do? What should I do? You should take these pills, right? So if you can repeat after me here. You should take these pills. It's very important that you talk out loud. É muito importante que você repita em voz alta para treinar a pronúncia, né? So you should take these pills. We also talked about you should drink a lot of water. You should drink a lot of water. And remember, this of here is pronounced as V, okay? Don't say off, okay? It's not off, it's of. This F here says V, it has a V sound. It sounds like V. So a lot of water, right? A lot of water. You shouldn't, this is the negative, okay? So it means you should not eat junk food. So you shouldn't eat junk food. Yeah? Você não deveria comer junk food. You shouldn't eat junk food. Comer besteira, comer porcaria. You shouldn't eat junk food. You must take a rest. Okay, you must take a rest. You mustn't go out in the rain. Okay, a negativa do must aqui vai ser mustn't. Pronunciation mustn't. So here it means must not. Okay, must not. Altogether becomes, in the contracted form, mustn't. So you mustn't. Notice that the T is not pronounced, okay? So it's mustn't. You mustn't go out in the rain. Você não deve sair na chuva. Não deve sair na chuva. You mustn't go out in the rain. So that's pretty much it about today's class. Remember that we have a curso básico completo, ok? Aprenda Inglês. Esse curso já está pronto na Hotmart. É um curso com 42 videoaulas. Ele tem 115 diálogos gravados por nativos. São 115 áudios, né? Todos gravados por nativos, inclusive nativos de países diferentes, com inglês americano, inglês britânico, para você se acostumando com inglês diferente também, sotaques diferentes. 18 quizzes, com perguntas e respostas. Esses quizzes são os testes que você faz depois que você escuta os diálogos, escuta e repete os diálogos, tem os quizzes que você faz para você reforçar o seu aprendizado. Existem também os PDFs de exercícios que você pode baixar, se você é daquele tipo de aluno que gosta de imprimir os papéis, escrever à mão. Tem todos esses exercícios com gabaritos também. Também há 3 livros áudio de bônus, 3 livros áudio, que você pode escutar, ler e escutar ao mesmo tempo. E no final tem um certificado também. Então é um curso bem completo, curso básico completo, leva mais ou menos uns 3 meses, você passa 2 horas por dia estudando todos os dias com esse curso, em 3 meses mais ou menos você completa ele. Você consegue conversar sobre o básico do inglês. Meu Instagram tá aqui, douglaspaula.academy, né? Ou em inglês, douglaspaula.academy, que esse ponto em inglês a gente fala dot. So douglaspaula.academy. It's the Instagram. My email is douglaspaula.academy@gmail.com. And we have o grupo de WhatsApp também, né? Para assistir, para ter acesso às aulas gratuitas. Os links estão todos na descrição deste vídeo, tá? Então você encontrará todos os links na descrição do vídeo. Qualquer dúvida, deixem aqui nos comentários. Durante a live, ou após a live também, pode deixar. A gente já está encerrando a live aqui agora. Então pode deixar comentários aqui após a live também, que eu respondo assim que possível. Thank you very much, everyone, and I'll see you next class.